So what do we find neurobiologically? So meditators practicing open monitoring, this kind of mindfulness in which you take in whatever arises, when they're exposed to pain, they had decreased activity in the lateral prefrontal cortex, so the part of the brain that's thinking about it and evaluating it was relatively quiet, but they had increased activation in the part in the posterior insula, so they were actually feeling it more vividly. So what we see neurobiologically is exactly the same thing the monks have reported for 2,500 years, and anybody who takes up these practices can see for themselves. You feel pleasure and pain more vividly, but you get less upset by it and less freaked out about it. And the reason you become less upset and less freaked out about it is because you're no longer resisting it. You make the transition that the samurai warrior made from hating the fly to being with the fly. So in our last little while, I want to give you an idea of how you can use these skills to work with everyday kinds of problems. Anybody here ever feel anxious? Yeah, we all do, and it happens quite a bit. So when cognitive scientists and clinical scientists study anxiety, they say it has 3 components to it. And anxiety disorders have 3 components to them as well. The first is physiological arousal. That's the activation of the sympathetic branch of the autonomic nervous system and of what's called the hypothalamic pituitary adrenal axis, which is basically a hormonal system that dovetails with the sympathetic nervous system to secrete adrenaline and create that wound up, roused up feeling that we're all too familiar with, right? There's a cognitive part of it, and that's all the negative fantasies about the future. This is the, imagining terrible things happening, which we all do quite readily when we're feeling anxious. And then there's a behavioral part of it. And these are typically our avoidance strategies, and these are what are most critical in developing an actual anxiety disorder. Because it's, as I mentioned before, it's not feeling nervous that's the problem. It's avoiding things in order to try to not feel nervous that becomes our problem.